Hi everyone, I am Dr. Vinod Abhichandani from the city of Ahmedabad, and I am glad to be here in Lucknow for the BPCON conference. We have just finished a panel discussion involving very important topic of stroke and hypertension, and there were great takeaways for all of us from this important discussion, mainly that stroke and hypertension are very closely interrelated, and post-stroke, how to manage the blood pressure, and we alluded to 2018 acute ischemic stroke guidelines published by the AHA, and then we had useful tips for everyone, including how to aim at primordial prevention, that is taking care of behavioral and metabolic risk factors, which include, apart from hypertension, which magnifies the risk of stroke by almost 6 times, other included risk factors are atrial fibrillation, diabetes, dyslipidemia, sickle cell anemia, and poor diet, including diet excessive in sodium consumption, poor in potassium level, and there may be inordinate drinking of alcohol, which is also supposed to be a risk factor, and several pills containing estrogen, especially contraceptive pills, if they are abused or used for a very long time, they can also predispose hypertensive individual to development of stroke. And in order to prevent stroke is the way we should go forward, and that was the crux of today's discussion. Thank you.